Your doctor orders a standard lipid panel, and you get back numbers for total cholesterol, LDL, and maybe your triglycerides. If everything looks like it falls within the normal range, you probably just move on with your day. Most men in their 30s and 40s treat those results like a clean bill of health. But that is exactly where the problem starts. The standard panel we use today was never actually designed to predict your long-term survival. It was built around the limited tools doctors had available decades ago, which means it misses the bigger picture of your health. When you filter through the current meta-analytic literature, including over 40 systematic reviews and meta-analyses, 3 specific markers consistently show hazard ratios above 1.5 for all-cause mortality. None of these appear on your standard panel by default, and your doctor will not order them unless you specifically ask. The part that should really concern you is that conventional markers like LDL or creatinine are lagging indicators. By the time those numbers finally move into the concerning range on your lab report, the underlying biology driving that change has often been breaking down for years. You are essentially looking at a rearview mirror and calling it a navigation system. In this video, you will learn which 3 markers the data actually flags as high risk. We will cover the clinical thresholds you need to look for and the specific lifestyle changes that actually move the needle for each one. If that sounds good to you, be sure to like and subscribe. Biomarker 1, Cystatin C and the kidney signal most labs ignore. Standard kidney function testing relies on creatinine to estimate your glomerular filtration rate, which is known as your eGFR. The problem here is that creatinine levels are heavily influenced by how much muscle mass you carry. If you are a lean, muscular man in your 30s, your creatinine-based eGFR might look perfectly fine even if your actual kidney filtration has already started to decline. The signal you need to see is being masked by your physique. Cystatin C solves this problem because it is produced by nearly every nucleated cell in your body at a constant rate. Since it is independent of muscle mass and clears through the kidneys, it acts as a much cleaner filter for your actual kidney function. This makes it a substantially stronger predictor of your long-term health outcomes compared to the old standards. Multiple large meta-analyses show that elevated cystatin C carries a hazard ratio for all-cause mortality between 1.74 and 2.04. To put that in perspective, that is roughly double the risk signal you would get from standard creatinine measures alone. This is not just a marginal improvement in data, but a completely different category of information for your health strategy. There is a second layer to this data that is even more interesting for your longevity. When your cystatin C-based eGFR and your creatinine-based eGFR disagree, that gap between the two numbers becomes the primary signal. This discordance carries a hazard ratio of 1.58 to 1.69 in the literature, meaning you do not even need cystatin C to be high in absolute terms for there to be a problem. A simple mismatch between these two measures independently predicts worse outcomes for your body. The creatinine to cystatin C ratio, or the CCR, adds a third dimension to your health profile. A higher CCR correlates with better muscle mass and nutritional status, and it predicts lower mortality with a hazard ratio of roughly 0.69 to 0.78 per unit increase. It is not just a kidney marker, but a reflection of the physiological state of your lean tissue. The best way to optimize this marker is through consistent resistance training. Trial data shows that 2 to 3 sessions per week, working at 60 to 80% of your 1-rep max for at least 8 to 12 weeks, builds lean mass in a way that directly improves your CCR. This is the minimum effective dose found in the clinical data, rather than just a general fitness suggestion. To take action on this, you need to ask specifically for a cystatin C measurement the next time you request a blood panel. Most labs offer the test, but it is almost never ordered by default during a routine physical. Biomarker 2, ApoB, and hs-CRP, the 2 numbers that outperform your lipid panel. When you get a standard lipid panel, your doctor looks at LDL cholesterol, which tells you the total amount of cholesterol carried inside those low-density lipoprotein particles. The problem is that this number doesn't tell you how many of those particles are actually floating around in your bloodstream. This distinction is vital because the particle count is what actually drives your risk of arterial damage, regardless of how much cholesterol each individual particle is carrying. ApoB is the specific protein attached to every single one of these dangerous particles, and since there is exactly 1 ApoB per particle, measuring it gives you a perfect head count of the invaders that can wedge themselves into your arterial walls to start forming plaque. This becomes a major issue in a scenario called discordance, which is when your LDL cholesterol looks perfectly normal but your ApoB count is dangerously high. Pooled cohort data reveals that having excess ApoB carries an adjusted hazard ratio of 1.24 for cardiovascular death and 1.12 for all-cause mortality, even if your other cholesterol numbers look fine. The research shows that reducing your ApoB is more closely tied to avoiding major heart attacks and strokes than lowering LDL alone. If you are a man under 45 without existing heart disease, you should aim for an ApoB level between 60 and 70 milligrams per deciliter, as that is where the data shows the lowest risk. If you want to move this number through your diet, you have a few proven options to consider over a 90-day window. Weight loss itself is a powerful lever, and dropping pounds on a low-calorie diet will lower your ApoB regardless of whether you are eating low-carb or low-fat. Mediterranean diets that are heavy on olive oil and nuts typically show a reduction of about 2.9 milligrams per deciliter after 3 months. Vegetarian and vegan diets actually show the strongest results in randomized trials, often dropping ApoB by 13 milligrams per deciliter compared to standard diets, while short-term paleo patterns usually fail to lower this specific marker. Just like we saw with Cystatin C, your doctor won't see your ApoB levels unless you specifically ask for the test. Then we have hs-CRP, or high-sensitivity C-reactive protein, which serves as a primary marker for what researchers call inflammaging. This number tracks the low-grade systemic inflammation that acts as a hidden engine for cellular aging and long-term disease. The risk here isn't like falling off a cliff, but rather a steady uphill slope where a reading below 1 milligram per liter is considered low risk. Once you hit 1 to 3 milligrams per liter, you enter the intermediate zone, and anything above 3 carries a hazard ratio of 1.4 for all-cause mortality compared to the low-risk group. Your trajectory over time is just as important as a single snapshot, because a rising hs-CRP level increases your risk significantly, even if you stay below the 10 milligram per liter threshold. The danger really spikes when you combine high inflammation with low vitamin D. In the cohort data, having an hs-CRP over 3 while your vitamin D is below 20 nanograms per milliliter didn't just add to your risk, it actually doubled your chances of cardiovascular and all-cause mortality. While 30 nanograms per milliliter is the bare minimum for bone health, the longevity and immune data suggests a better target is between 40 and 60. The Endocrine Society points out that we don't have a universal trial proving this target for everyone. So you should view that 40 to 60 range as an optimization zone, rather than a strict medical requirement. To bring these levels down, you can use resistance training and moderate cardio, which both trigger the pathways that dampen inflammation. Sleep is another massive factor here, and losing just a few hours of rest is one of the fastest ways to spike your hs-CRP from the low-risk category into the danger zone. You might see NMN and NR supplements marketed as a cure for this type of inflammation. And while they do raise NAD levels in humans, we currently have zero data proving they extend human life. For now, the evidence for those compounds is strictly limited to animal studies. The reality is that none of these 3 markers, Cystatin C, ApoB, or hs-CRP, are going to show up on your blood work by default. You have to be proactive and request them specifically. I want you to pull up your most recent blood panel right now and see if any of these were actually tested, because if they weren't, you have a massive blind spot in your health data that needs to be closed. The most effective way to improve all 3 of these markers at once is a simple lifestyle stack. You need to be lifting weights 2 or 3 times a week, eating a diet that leans toward plants or Mediterranean staples, and keeping your vitamin D in that 40 to 60 range. Most importantly, you have to stop viewing sleep as something you do if you have time, and start treating it as a non-negotiable requirement for your biology.